Hi, Fitness Gym here, back with another video. Let's get started. We're going to be talking about back injuries, specifically in the lower back. As you can see in this clip, I was doing bent over rows with 35 pounds on each side, so that was 115 pounds, and you can see that my lower back is rounding. And because my lower back was rounding, I actually experienced an injury, and I have to take some time off because my lower back is absolutely tweaked right now. So we're going to get into the video on what my process is going to be for getting back to recovery and going back to working out. So there's two things that you want to avoid. You want to avoid this. You want to avoid this. What you don't want to avoid is this. The floor, surprisingly, is actually better for your back to lay on than the actual bed and couch. But what is even more important than that is an ice bath. I took my ice bath right after my injury. I poured some of this Epsom salt into the bath, and I poured way more than half of the bag, but I was really just trying to aim for pouring half of the bag in. The eucalyptus mint, and then I poured a quarter of the bag into the tub. The only reason why this cold bath sucked so much was because the water was actually rising up my body as I was sitting there. So it was like I was walking into a super cold lake. I was slowly walking into a super cold lake. Right there is when I poured the ice in, and then I shut the water off, and then that's when it actually got decent. Like, it wasn't that, I mean, it was cold, but I was able to handle it. The only reason why it sucked at first is because I didn't want to go straight into the water with a bad back. I didn't want to end up hurting myself. Anyways, here's the clip of me taking my 15-minute ice bath. You can lay on carpet, you can lay on hardwood floor. You can even lay a blanket or two down on the floor while you lay on it. Here's a clip of me icing my back on the floor. 15 minutes on, then 20 minutes off, then 15 minutes on, then 20 minutes off, and then just repeat. Now, in between my 20-minute rests, I was actually stretching and doing some mobility work, which I will show you right now. So for these leg lifts that I'm doing right now, I recommend you do 10 leg lifts per leg. Notice how slow and in control I'm going. Make sure you remember to keep your leg as straight as possible and just be nice and slow with the whole movement. And then I did some leg crossovers. I also recommend you do 10 crossovers each leg. I only did like 5 crossovers on each leg, but just do 10. Just do as many as you can, honestly. Now, I don't really have the name for any of these stretches I'm doing, but we'll just call this the leg hug. I did like 10 seconds on this leg. Well, not 10 seconds in the video, but 10 seconds in real life. Slowly went down, and then I just slowly brought the next leg up. 10 seconds for that leg as well. And then you're just going to want to do that 10 times for each leg. And then I did glute bridges or hip thrusts, whatever you want to call them. I did those nice and slow, 10 reps. That's how many you're going to want to do. Then you're going to do some one-legged bridges, and you're going to do 10 reps each leg. And then you're going to want to do a leg lift while you hold that leg bridge. Now these, I'm just bringing my knees to my chest, or I'm trying to get semi-close to that. And then I'm just extending my legs out to the sky, and I'm coming back down to that little hug. Notice how when I do that hug, I actually give my knees like a nice squeeze so I can really feel it in my lower back, and then I extend my legs out to the sky. So you just want to do those two things 10 times. Next up on our list, these ones are probably the most effective ones that happen with me. You can even see me struggling to just bring my legs down in the beginning. Anyways, you just do what you see here. I'm sliding my feet back, and it's just bringing my knee up. And you're really going to feel that in your glutes, and you're going to feel it in your lower back when you're doing these. I really focused on doing these more than anything else in this video because I felt the best stretch out of these. So I did 10 on the left leg and then 10 on the right. And then I did these mini leg lifts. I did 10 reps of those mini leg lifts, just each leg. And then to finish it off, I bring my legs all the way up and back down, but you should actually do 10 times of that as well. Then I did these, I don't know, one-legged Superman lifts from, I don't know how to explain these ones, but I just did these little leg lifts when I was laying down on my stomach. 10 reps per leg. Then these ones are called the cat and the cow. So I am currently breathing in, and then I am breathing out like that. And then I'm just going back and forth. I'm really squeezing at the top, and I'm really squeezing at the bottom. And then while I'm holding that squeeze, I'm actually rocking myself slightly backwards, slightly forward, slightly backward, slightly forward, and even to the side as well. You can't really see it on the video, but just kind of rock yourself to the sides and back and forth, and then do it with the cat position as well. Just rock yourself back and forth, side to side. Whatever you need to do, whatever makes you feel that little stretch, just do that, and then you're going to want to do those 10 reps. And then I guess you can call these kneeling mountain climbers to donkey kicks. I don't know, just bring your knee to your chest and then do a donkey kick after that. I just did 10 reps per leg. I did 10 sets. And then I did these little chest raises while laying on my stomach. Same old 10 reps, 10 sets. Then I got on my side and I started doing leg extensions, clamshells. I don't know what you'd call these. I was doing them. Then I was just kicking outwards like that, bringing my knee to my chest, or at least trying to. Flipped around on the other side, and I just did the same thing. As you can see, you can actually see some funny little holes on my back. Yeah. That's actually from doing a suction cup therapy. You can get these on Amazon, and then you just got to read the instructions on how to do them. Just put them on where your back was injured. Anyways, back to our leg lifts. And for these, I was just bending down. I was really just bringing my chin to my chest, then my chest to my stomach, and then my stomach to my groin. And I was just going as low as I can until it really started to hurt. So right about there, I'm really getting that stretch. Then in this clip, I'm just bending my body sideways, and I'm just doing them on both sides, going nice and slow, getting that stretch. Then I'm just leaning all the way back. This is another really good stretch that I've been doing a lot. Just kicking out, just taking my leg up as far as I can, and just doing those. I really feel stretching that left glute. Then just some neck stuff, just rolling my neck, just doing some circles. I'm doing them clockwise, then counterclockwise. 10 reps, 10 sets, you know the drill. Then we're just doing side to side and a back to forth head movement for the neck. Nice and slow and in control. And then we're just looking to the left and the right. Then we'll be doing these spinal rotators. Don't know what you call them. Just spin that spine. Then to finish off this video, we're going to be doing some seated good mornings. You can't see it, but I have my feet on an actual 45-pound plate just to keep my knees at 90-degree bend. All of these mobility stretches and exercises were 10 reps of 10 sets. And if you can do more, do more. And just do it every single day as often as you can. Ice baths, and stretching and that mobility stuff. You can take stuff like Stop Pain. And then regarding medications, I'm not going to mention that at all. You should actually ask that to your doctor and he'll direct you into the right path for taking the proper medications.